Welcome to the channel. Today we're diving deep into one of the most common yet underestimated health issues in modern life: stomach acidity. It's that burning sensation you feel after a heavy meal, that uncomfortable bloating after coffee, or that sour taste creeping up your throat when you lie down at night. Stomach acidity, also called acid reflux or heartburn, might seem harmless at first, but if ignored, it can quietly damage your digestive system, affect your mood, and even lead to long-term complications like ulcers or inflammation of the esophagus. In this video, you'll learn exactly what causes acidity, how it develops inside your stomach, what experts recommend to manage it, and how a few smart lifestyle and diet tweaks can transform your gut health from irritated to balanced. Inside your stomach, powerful acids help digest food. These acids are mostly hydrochloric acid, produced naturally by your stomach lining to break down proteins and activate digestive enzymes. The stomach has a protective mucus layer that shields it from its own acid. However, when you eat too fast, skip meals, or overload your diet with spicy or oily foods, the delicate balance between acid and protection gets disturbed. The acid starts moving upward into the esophagus, the tube connecting your throat to your stomach, causing that characteristic burning sensation known as heartburn. While an occasional episode isn't dangerous, frequent acid reflux means your body's protective barrier is weakening, and that can lead to chronic problems like gastroesophageal reflux disease, or GERD. Doctors explain that one of the biggest triggers behind acidity is lifestyle. In our fast-paced world, people eat meals on the go, often late at night with little attention to what they're consuming. Processed foods, caffeine, alcohol, and carbonated drinks all stimulate acid production. Combine that with stress and lack of sleep, and your stomach becomes a perfect storm for acidity. Stress plays a major role because it affects the vagus nerve, which controls digestion. When you're anxious, your body produces more cortisol, the stress hormone, which slows digestion and increases acid secretion. That's why stress management is not just good for your mind, it's essential for your stomach too. Another major contributor is overeating. The stomach is a muscular sac designed to expand slightly when you eat, but when it's overloaded, pressure builds up, forcing acid upward. Experts recommend smaller, more frequent meals instead of 2 or 3 large ones. Eating mindfully, chewing slowly, and avoiding lying down right after meals can drastically reduce reflux symptoms. Also, posture matters more than people realize. Slouching or lying flat after eating allows acid to flow back more easily into the esophagus. Simply sitting upright or walking for a few minutes after a meal can support digestion naturally. When acidity becomes chronic, the lining of the stomach can get inflamed, a condition known as gastritis. Over time, this irritation may lead to ulcers, small open sores in the stomach or intestinal wall. Ulcers can be extremely painful, often triggered by infection with a bacterium called Helicobacter pylori or by excessive use of painkillers like ibuprofen. The symptoms include sharp stomach pain, nausea, loss of appetite, and sometimes vomiting. Medical experts emphasize that ulcers should never be ignored. Early treatment with antibiotics or acid-reducing medications can heal them completely, but untreated ulcers can bleed or cause severe complications. Beyond medication, one of the most powerful tools for healing the stomach is diet. Foods rich in natural fibers, antioxidants, and probiotics help neutralize acid and restore healthy gut bacteria. Fruits like bananas, melons, and papayas have natural antacid properties. Vegetables such as spinach, kale, and cucumbers cool the digestive tract. Yogurt and kefir provide probiotics that balance the gut microbiome, reducing inflammation and promoting healing. Meanwhile, experts suggest avoiding spicy foods, citrus fruits, tomatoes, chocolate, onions, and caffeine, which are known to trigger acidity in sensitive individuals. Water intake is another key factor. Drinking small sips of water throughout the day dilutes stomach acid and keeps digestion smooth. However, gulping large amounts of water right after eating can have the opposite effect. It may push undigested food upward, worsening reflux. Warm water with a bit of honey or aloe vera juice in the morning can soothe the stomach lining naturally. Herbal teas like chamomile, ginger, or licorice root also offer relief by calming inflammation and promoting better digestion. Sleep habits directly influence acidity too. People who go to bed immediately after dinner are more likely to experience acid reflux because gravity no longer helps keep the stomach contents down. Doctors recommend waiting at least 2 to 3 hours after eating before lying down and elevating the head of the bed slightly to prevent nighttime reflux. Wearing tight clothing around the waist can also put pressure on the stomach, so looser clothes are recommended for comfort and digestion. Smoking and alcohol are two of the most damaging factors for stomach health. Nicotine weakens the lower esophageal sphincter, the valve that keeps acid inside the stomach, while alcohol not only increases acid production but also erodes the protective mucosal layer. Quitting smoking and reducing alcohol intake can dramatically reduce both acidity and ulcer risk. In fact, gastroenterologists often say that these two changes alone can heal years of stomach irritation in just a few months. Experts also highlight the importance of maintaining a healthy weight. Excess body fat, especially around the abdomen, increases intra-abdominal pressure and pushes acid up into the esophagus. Even a modest weight loss of 5 to 10 pounds can make a noticeable difference in reducing reflux symptoms. Regular physical activity such as walking, cycling, or yoga keeps digestion active and improves gut motility. However, exercising immediately after eating can worsen reflux. It's best to wait an hour before starting physical activity. While diet and lifestyle play major roles, sometimes medical guidance becomes necessary. If acidity persists despite healthy habits, a gastroenterologist may recommend diagnostic tests like endoscopy or pH monitoring to identify underlying causes. In some cases, medications like proton pump inhibitors or H2 blockers are prescribed to reduce acid production and give the stomach time to heal. These medications are effective when used correctly under medical supervision but shouldn't be taken continuously without a doctor's advice, as long-term use can interfere with nutrient absorption. Natural healing takes time, but consistency is the secret ingredient. Many people look for quick fixes through over-the-counter antacids, which can provide temporary relief but often mask the deeper cause of the problem. Antacids neutralize existing acid but do not prevent your stomach from producing more later. Frequent use can also lead to imbalances in mineral absorption, particularly magnesium and calcium. That's why doctors encourage long-term healing through lifestyle balance rather than dependency on pills. Listening to your body's early warning signs like frequent burping, bloating, or mild chest discomfort can help you make corrections before acidity turns chronic. A critical yet overlooked factor in acidity management is the timing of meals. Experts in digestive health emphasize that eating at irregular hours confuses the body's natural circadian rhythm. The digestive system works best when it has predictable times for meals and fasting. Intermittent fasting or spacing meals with at least 4 hours in between gives the stomach time to process previous food completely, reducing the load on acid secretion. Late-night snacking, on the other hand, forces the stomach to remain active when it should be resting, making reflux worse. Following a routine where dinner is eaten 2 to 3 hours before sleep can significantly improve digestion and minimize acidity. One interesting point highlighted by nutritionists is that our modern diet has become far too acidic. Processed foods, sugar, refined flour, and soft drinks all contribute to creating an acidic environment in the body. Balancing your diet with alkaline foods such as leafy greens, almonds, and coconut water helps neutralize excess acidity. Simple home remedies like mixing a teaspoon of baking soda in water can bring temporary relief because it neutralizes stomach acid chemically, though it should be used sparingly. Natural healing takes time, but consistency is the secret ingredient. Many people look for quick fixes through over-the-counter antacids, which can provide temporary relief but often mask the deeper cause of the problem. Antacids neutralize existing acid but do not prevent your stomach from producing more later. Frequent use can also lead to imbalances in mineral absorption, particularly magnesium and calcium. That's why doctors encourage long-term healing through lifestyle balance rather than dependency on pills. Listening to your body's early warning signs like frequent burping, bloating, or mild chest discomfort can help you make corrections before acidity turns chronic. A critical yet overlooked factor in acidity management is the timing of meals. Experts in digestive health emphasize that eating at irregular hours confuses the body's natural circadian rhythm. The digestive system works best when it has predictable times for meals and fasting. Intermittent fasting or spacing meals with at least 4 hours in between gives the stomach time to process previous food completely, reducing the load on acid secretion. Late-night snacking, on the other hand, forces the stomach to remain active when it should be resting, making reflux worse. Following a routine where dinner is eaten 2 to 3 hours before sleep can significantly improve digestion and minimize acidity. One interesting point highlighted by nutritionists is that our modern diet has become far too acidic. Processed foods, sugar, refined flour, and soft drinks all contribute to creating an acidic environment in the body. Balancing your diet with alkaline foods such as leafy greens, almonds, and coconut water helps neutralize excess acidity. Simple home remedies like mixing a teaspoon of baking soda in water can bring temporary relief because it neutralizes stomach acid chemically, though it should be used sparingly. Natural alternatives such as banana smoothies, honey water, or cold milk are safer and gentler for the stomach lining. Gut health experts also talk about the connection between acidity and the microbiome, the trillions of bacteria living in your digestive tract. A balanced microbiome ensures smooth digestion, proper nutrient absorption, and controlled acid secretion. When the gut flora is disturbed, often by antibiotics, poor diet, or stress, harmful bacteria can dominate, increasing inflammation and irritation. Including probiotic-rich foods like yogurt, kefir, sauerkraut, or even probiotic supplements can help restore this balance. Prebiotic foods like garlic, onion, and asparagus act as fuel for good bacteria, keeping the gut environment healthy. Hydration plays a surprisingly big role in acidity control. The stomach needs enough water to dilute digestive acids and maintain proper pH balance. Dehydration makes the acid more concentrated, which intensifies the burning sensation. Drinking lukewarm water before meals prepares the digestive tract, while sipping on water with lemon, in small amounts, can actually help balance acidity due to its alkalizing effect once metabolized. On the other hand, carbonated sodas and cold beverages can worsen symptoms by increasing gas and pressure in the stomach. A good practice is to replace all fizzy drinks with water infused with cucumber, mint, or basil for natural freshness. Medical experts often explain that not all acidity comes from what you eat, sometimes it's about how you eat. When meals are rushed or eaten in a distracted state, the brain fails to send proper digestive signals. The stomach produces acid irregularly, leading to either too much or too little acid, both of which cause discomfort. Practicing mindful eating where you chew slowly, enjoy each bite, and avoid screens can have measurable effects on digestion. Studies have shown that people who eat slowly produce less gas and experience fewer reflux symptoms. For people suffering from chronic ulcers, healing requires a combination of medical and dietary management. The bacterium Helicobacter pylori mentioned earlier can survive in the acidic environment of the stomach by producing an enzyme called urease that neutralizes acid around it. This allows it to damage the stomach lining over time. Doctors usually treat this infection with a combination of antibiotics and acid-suppressing drugs for several weeks. Alongside medical treatment, patients are advised to eat soft, non-irritating foods and avoid alcohol, smoking, and spicy meals until healing is complete. Certain natural substances can also support ulcer recovery. Aloe vera juice, for example, has soothing and anti-inflammatory properties that can help reduce irritation in the stomach lining. Honey, particularly Manuka honey, is known for its antibacterial effects and can promote ulcer healing when consumed in moderation. Licorice root extract has been used traditionally to strengthen the mucosal barrier of the stomach, though it should be used carefully to avoid affecting blood pressure. Incorporating these remedies along with medical advice can accelerate recovery safely. An interesting modern approach to managing acidity involves the gut-brain connection. The stomach and brain communicate constantly through the vagus nerve, which means emotional stress directly affects digestion. Anxiety, anger, and tension can trigger acid secretion and slow gastric emptying, creating a cycle of discomfort. Practices like meditation, yoga, and deep breathing exercises help calm this connection. Even 10 minutes of slow breathing before meals can lower stress hormones, improve blood flow to the digestive tract, and help the stomach function more efficiently. Your posture throughout the day also influences acid control. People who sit for long hours in a hunched position compress their abdominal organs, increasing intra-abdominal pressure. This makes reflux more likely, especially after eating. Stretching the torso, taking short walks, and maintaining an upright spine while sitting or standing help relieve this pressure. Yoga poses like Vajrasana, kneeling pose, after meals, and Bhujangasana, cobra pose, strengthen digestive muscles and enhance acid balance naturally. In addition to lifestyle habits, the environment in which you eat plays a surprisingly big role. When meals are consumed in a noisy, stressful, or rushed environment, digestion slows down. Creating a calm eating environment, sitting at a table, taking a few deep breaths before the first bite, and keeping distractions away can have measurable physiological benefits. This is because the parasympathetic nervous system, responsible for digestion, activates only when the body feels safe and relaxed. Another crucial but underestimated factor is sleep quality. Sleep deprivation increases stress hormones and triggers inflammation throughout the body, including the stomach. People who sleep less than 6 hours a night are more likely to report frequent acidity and indigestion. Building a nighttime routine such as dimming lights, avoiding caffeine or heavy meals late in the evening, and going to bed at a consistent time helps the body maintain hormonal balance. A slightly elevated sleeping position using 2 pillows or a wedge can also prevent acid from rising during the night. Caffeine is another sneaky contributor to acidity that many people overlook. Coffee, tea, and energy drinks stimulate stomach acid secretion. For some individuals, even 1 cup of coffee on an empty stomach can cause burning and discomfort that lasts for hours. It's not just the caffeine itself, but also the acids naturally present in coffee beans that irritate the stomach lining. Health experts recommend limiting coffee to 1 cup a day or switching to low-acid options like cold brew. Green tea is often seen as a healthier alternative, but excessive consumption can also cause acidity in sensitive people due to tannins. Herbal teas such as chamomile, fennel, and ginger provide a soothing and caffeine-free alternative that supports digestion rather than aggravating it. It's also important to recognize that acidity symptoms can mimic those of other conditions, which is why accurate diagnosis matters. Sometimes, chest pain from acid reflux can resemble that of heart problems, leading to confusion. Persistent acidity accompanied by difficulty swallowing, vomiting, or weight loss should always be evaluated by a doctor to rule out more serious issues. Early medical consultation can prevent chronic damage to the esophagus, known as Barrett's esophagus, which occurs when stomach acid continuously irritates the lining. Dietary fat plays an interesting role in acidity. While healthy fats are essential for hormone production and energy, greasy or fried foods delay stomach emptying, leading to longer exposure of the stomach lining to acid. Deep-fried snacks, fast food, and rich desserts tend to linger in the stomach and worsen reflux. Instead, nutritionists suggest focusing on unsaturated fats like those found in olive oil, avocados, nuts, and seeds. These fats digest more easily and also have anti-inflammatory properties that benefit the gut. Including a small amount of healthy fat in each meal can actually help regulate acid production and keep you full longer, reducing the urge to overeat. Many people also experience acidity due to certain food intolerances. For instance, lactose intolerance can cause bloating and gas, increasing internal pressure and promoting reflux. Similarly, gluten sensitivity can lead to inflammation in the intestines and slow digestion. Identifying trigger foods through an elimination diet where you remove one potential irritant at a time can help pinpoint the exact cause of your acidity. Once identified, avoiding those triggers can lead to rapid improvement without the need for medication. Fermented foods can be a double-edged sword. While they are rich in probiotics, certain fermented items like pickles, vinegar, and kimchi can increase acidity in some individuals because of their acidic preparation. The key is moderation. Small portions of natural yogurt or kefir are usually well-tolerated and beneficial, while vinegar-based or spicy fermented foods might worsen symptoms. Listening to your own body's response is the most reliable guide. Interestingly, the emotional component of eating plays a huge role in how the body digests food. When you eat while angry, anxious, or distracted, your body remains in fight or flight mode, diverting energy away from digestion. This can result in undigested food fermenting in the stomach, producing gas and acid. Taking even a few minutes to calm yourself before eating by practicing gratitude, deep breathing, or a short pause can make digestion significantly smoother. A lot of people assume that acidity is purely a digestive issue, but experts are now discovering its links to other body systems. Chronic acid reflux can lead to respiratory problems such as chronic cough, asthma-like symptoms, or sore throat due to acid reaching the airways. In severe cases, micro amounts of acid can even travel up to the sinuses, causing persistent nasal irritation. This is why treating acidity holistically by managing both lifestyle and medical aspects is essential for complete relief. Vitamin and mineral deficiencies can also contribute to acidity. Low magnesium levels, for example, can impair the function of the sphincter muscle that prevents acid from flowing upward. Vitamin B12 deficiency, which is sometimes caused by long-term acid-suppressing medication use, can weaken digestive function and energy metabolism. Maintaining a balanced diet rich in vegetables, legumes, whole grains, and lean proteins ensures your body has the nutrients it needs to keep the digestive system strong and responsive. When it comes to managing acidity naturally, consistency is everything. Drinking warm water first thing in the morning, avoiding heavy meals close to bedtime, and replacing processed snacks with fruits and nuts can work wonders over time. Adding small habits like walking for 10 minutes after each meal, avoiding smoking, and maintaining proper hydration may seem simple, but their combined impact is powerful. People who follow such routines often report dramatic improvements within weeks. The role of medical professionals in acidity management goes beyond prescribing medication. Gastroenterologists often emphasize that patient education is the foundation of prevention. Understanding how your stomach functions helps you make informed choices daily. For example, learning that your stomach produces acid even when you think of food explains why skipping meals or irregular eating schedules can trigger acidity. Preventing long gaps between meals keeps the stomach from becoming overly acidic. One practical tool recommended by nutritionists is keeping a food diary. Recording what you eat and how you feel afterward helps identify hidden triggers. Some people may find that even healthy items like citrus or tomatoes cause discomfort, while others tolerate them well. Patterns become clear when tracked consistently, and this allows for personalized adjustments rather than one-size-fits-all advice. If you found this video helpful, don't forget to like, share, and subscribe to the channel for more health tips and expert advice every week.